everyone. Let me first start by saying I'm sorry that we're late. It's my fault. I know everything and anything I can possibly learn about dogs, but when it comes to computers, there's just no help for me. I gave up a while ago. So I apologize for being late. Apparently, something happened with my Chrome is not my Chrome, it's my Edge. I don't even know what that means. Thank God Lori's behind the scenes helping me. And so she was able to get me under control pretty quickly. So I apologize for being late. And thank you for being so patient, Dr. Ericka. I really appreciate your patience with my inability to run a computer. But we're here. We made it. Hopefully we didn't lose any of you and that you're going to be coming on and asking lots of questions to us. If you haven't listened to the podcast that we did with Ericka a couple weeks ago, it was posted. We talked a lot about mental illness in pets, which was a word that I don't want to say I wasn't comfortable using it. I'm so glad we're using it now because it encompasses so much more than just anxiety. And so Dr. Ericka was able to talk a lot about that, but she's here now. So if you did listen to it and you were confused during it, you can ask questions. But Dr. Ericka, hello, welcome.
Hi. It's good to be here.
Yeah, so I'm hoping we can cover a lot of ground and just kind of learn a little bit more about mental illness with our dogs and our cats and what's going on with them. I know we talked a lot about we got pretty deep into it with just having that hour that we just spoke about that in particularly. But just to kind of do a refresher a little bit, tell us a little bit about, so if we have any listeners on there that didn't get a chance to listen, just tell us a little bit about you, where you got your education, why you're so passionate about mental illness in dogs and cats, and just give us a little synopsis, I guess, about it.
Yeah, sure. So 11 years ago now, I graduated from Oregon State University with my veterinary degree. And I know a few other doctors who have done this, but it's pretty unusual. At the time I graduated with my veterinary degree, I was also one session away from having my acupuncture certification finished. So I was already pretty deep into the holistic world. And then the first job I got was at the first holistic clinic that had ever been founded in BC, Canada. Um, so I was right into the holistic side of things right away. And as far as the mental illness behavioral issue component, so I dealt with my own mental illness issues for years and found that drugs really didn't help, but that alternative solutions, acupuncture, herbs, things like that, were amazing. And then when I was in the acupuncture course, I had my very first puppy, which was quite an experience. Of course, they always are. And my Doberman was just, oh, he was so sweet and the most sensitive dog ever, like lots of my patients, who had a very strange mental tick where he didn't have separation anxiety or anything like that. But if we put him in his crate with a blanket, he would just start to shred the blanket and eat it, literally consume it. So I spent, I don't know, 6 or 8 months, possibly longer, just being panicked all the time, this low grade panic of we're gonna have a surgery someday. I know it because he keeps eating all this fabric and I can't not let him have a bed. Um, so as I was in the acupuncture course, we did briefly cover mental illness. We covered what we call Shen disturbances in Chinese medicine. And that is, of course, what he's doing is not a normal behavior. That's exactly what was happening with him. And I put him on some herbs for it. And within 12 hours from the first dose, the behavior had completely stopped. It blew my mind. It was so, I'd seen results with Chinese medicine already at that point, but nothing that rapid and
Wow.
dramatic.
Wow.
So if I wasn't already convinced, that sold me. And I then was on a mission to treat all kinds of what we call behavioral issues, but are really mental health issues in animals using herbs, acupuncture, but mostly herbs, really.
Isn't it interesting how when doctors prescribe medications, we don't have to be convinced over and over and over and over and over again that they're working. But when it's an herb, we have to even in ourselves, even when we have this holistic nature about ourselves, we have to be like, I don't know, is it in my head or
Yes.
and we do this for so long until we finally go, all right, until the lightning bolt comes down and we have those moments. And I think that's what makes, at least for me, I'm assuming for you, I'll let you speak for yourself, but that's what makes me so passionate about it, is because I've been struck by that lightning bolt and I've had that aha moment, and it feels so good to be here. Because I didn't, unlike you, I was so unfortunate to have been bombarded in traditional medicines and not really understanding what we can do with all of what is available that the earth has provided us. So having that lightning bolt moment is why I speak out so much, because I've seen it.
Yeah.
It's amazing. So, and we need it. These animals are getting more and more anxious, which is a question I want to ask you. I know we talked about a lot of this on the podcast, so some of it's recapping, but why do you think 11 years it's been, you said, since you've been a veterinarian. For me, I've been in this field. I'm much older than you, and I think, and I'm pretty sure, but I never saw anxiety before. And I know probably some of it was that we weren't diagnosing it and we didn't understand. They were just the bad dogs. But separation anxieties, but has that been your experience in 11 years? Is it getting worse, or did you come into this with anxiety being a problem?
Well, my perspective on any of these issues, autoimmune disease, allergies, cancer, behavioral issues, mental illness, it's a little bit skewed because I've been in holistic practice the whole time I've been a veterinarian. And so most of the cases I get are unusual cases, the extremely sensitive patients. So I see a lot more of these things than a typical practice does. But of course, before vet school, I had spent some time in regular average practices and seen the kind of mix of cases they got. And now I know from talking to colleagues what sort of mix of cases they're getting now. And I would say that we are seeing a lot more mental illness in dogs and cats, and anxiety is probably the number one. And all of the different forms of anxiety, including the kind of reaction, fear, aggression kind of stuff, all of that. And I think there's a number of reasons for it. Certainly, I have seen some of it related to inflammation and diet and over vaccination and poor choices of breeding lineages. Those things all factor into that. But I think probably a bigger factor is lifestyle. You know, if you think about how dogs were living 20 years ago versus how they're living with us now, it's quite different. Lots of people have dogs. I would say a higher percentage of people have dogs in apartments or other places where the dogs don't get to spend a lot of time outside sniffing things, which that's huge. That's like meditation for them. So when they can't do that, it's abnormal and it makes them kind of crazy. You know, the best example I have of this really comes from the horse world, where we see dramatic differences between horses that are kept out in fields just with a run-in shed versus horses that are kept in a 12 by 12 stall all day, every day. And obviously horses are large plains herbivores. They're supposed to be on a field moving around. Sorry, I have some cat drama behind me. And then we put them in this 12 by 12 box and take them out 1 hour a day and work them and put them back, and they just go crazy. They're absolutely nuts, stereotypical behaviors, all kinds of things. And we're seeing that in dogs now too, as we have them live a less and less normal lifestyle for their species.
Yeah. Oh my gosh. In the last live that we did with Dr. Candazer, I have bottle babies, so don't worry. I had them crawling on me. Is everything okay?
I'm just going to stop this. They're scary.
Okay. She'll be right back with us, everybody. The life of a veterinarian, right? We gotta attend to our animals, make sure that they're safe. Everybody's good? Oh my gosh. It wouldn't be a great episode if we didn't have animal interruptions. Right. We have to have those, right?
And behavior-based interruptions here, of course.
Of course.
We have almost no conflict in this household ever. And then right now they feel like they need to argue. Oh, it's going to happen again, probably. Oh, well.
It's kind of interesting because it's actually perfect timing, because I tell people all the time, like, your animals are so in tune to you and they know what's going on. And so when you're distracted and the attention isn't on them, a lot of times, even just like a little child, when mom gets on the phone, they they want that attention. And so they act up. It's not different in everybody else's home. It's the same thing. As soon as you get on the phone, the animals act up, the kids act up. And it's because the energy has changed and they feel it. Would you agree?
Yes. And this is a part, so the dogs are living more abnormal lifestyles compared to normal dog life, but also compared to 20 years ago, we are living much busier, much more stressful,
Yeah.
much harder lives emotionally for us. And of course, our animals that live in our homes and sleep in our beds and all of this, of course, they pick up on that. And so they're experiencing increased stress as well. Even if you still, live on 20 acres and just open the door and let your dog run around and sniff outside and take them for walks every day, they're still likely to experience more stress than they would have in that similar kind of lifestyle 20 years ago because you are probably more stressed.
Right. No, absolutely. That stress just gets carried down. Do you, when we talk about mental illness and we talk about it, what is that? A lot of times people just think, okay, that must be anxiety, but you defined it as much broader than that. Can you kind of help us define a little bit when we are talking about mental illness?
Yeah, so it's interesting you should ask this because of my own journey. I have a very interesting definition. Um, so anybody whose brains do not function like the typical, we're talking more about neurodivergence nowadays, where your brain doesn't function like a typical brain does, and maybe it makes you more predisposed to anxiety or depression, or you have some other kind of difference. That alone doesn't make for mental illness, though. Mental illness is when that combines with usually stress triggers in your life, things like that, to cause you to have symptoms that affect your life in a negative way. So just because you're predisposed to depression and maybe look on the darker side of things most of the time doesn't mean you're having trouble until you are, until it starts affecting your function and making you miserable all the time. That's a kind of a different level of it. So this applies to just about anything we think of as a brain issue or difference, from things like autism to bipolar disorder, schizophrenia, paranoia, anxiety, depression, PTSD, which, a lot of these other ones are things that you're either born with or you're born with a predisposition for them. PTSD may be less so, and that's mostly related to traumatic episodes in your life and your brain not being able to process them at the time. I'm seeing lots more PTSD in dogs too, so that's why I specifically bring that one up.
Yeah, I see that. Well, as a groomer, we see it a lot, and it may not be. I'm going to kind of interject there, even as you'll probably see this as a veterinarian. PTSD isn't always because something horrible happened. It could be, I didn't want to get a bath, or I didn't want to go to the veterinarian, and that scared me because I got I got a shot, or I got this. That can be PTSD. It's not always, and sometimes people hear the word PTSD and they just think, oh, someone abused the animal, but that's not it. It's what they consider traumatic, correct?
Yes.
Yeah.
I have a patient actually who he's from the shelter, but he was born at the shelter. He was a puppy born to a pregnant mom who came to the shelter, had a perfectly fine puppyhood there with a foster family, then was adopted by my clients who currently have him. So they know his whole life history.
Aww.
And he has anxiety related to PTSD because a garbage can lid closed one time on a walk and startled him. PTSD is just what happens in your brain when you experience a traumatic event that your brain can't process. And so for some of that, that's, serious, what we think of as big trauma, like combat trauma, or that's the classic one, of course, or physical abuse or things like that. But it can also just be some emotional event happened related to, maybe somebody raised their voice one time at you and you're just very sensitive. And so you weren't able to process that and you kind of shut down. And now that trauma is sort of stuck in your brain, stuck in your body. And that's PTSD just the same. And it can affect your life in the same level as the ones we think of as bigger PTSD.
Right. I just think, you might need to.
Yes.
We're going to have to let her take care of that. None of us want to see a giant cat fight. It's interesting because for those of you who don't know, I run a cat hotel and I also have a doggy daycare. And I was telling our listeners, Dr. Ericka, that I so I run a doggy daycare and I also have a cat hotel. And I tell people all the time, I would rather break up a fight between a pit bull, a German shepherd, and a Rottweiler than two cats. I just, breaking up a cat fight, you need to stop it before it becomes one, because it's not pretty. They have all sorts of ways they can get us.
Yes. Cats are very pointy. Yeah.
And they can contort their bodies in all sorts of ways that you're like, what just happened? Why are you attached to my back? I can't get you off. So I was like, she's got to break that up. Trust me, before it becomes a bigger issue. So you had mentioned autism and a few other things. Is there any, I wouldn't even know how to not that I would diagnose, I'm not a veterinarian, but how would you, do animals get autism, do you think?
I think so.
Okay.
From my perspective as someone on the spectrum, I do think animals get autism, but it's very easy to look at someone's behavior and say, oh, you're anxious, which I think is why anxiety is the number one diagnosed behavioral issue, mental illness in dogs and cats, because it's easy to do. You don't have to sit down and have a conversation with them about what their life is like. Their
Right.
pet parents can say, this is what behavior I'm seeing, and you can go, oh, well, that sounds like anxiety. And because PTSD is a lot related to anxiety, we can see that easily as well. But things like schizophrenia, dissociative identity disorder, which used to be called multiple personality disorder, autism, things like this, I think do exist in animals. Autism in particular, I think I have met a couple animals that I really felt were autistic.
Yeah.
But it's just, it's so impossible to really define that in an animal that we just don't diagnose it officially. And this is part of the conversation we had last time about the hesitance of the veterinary community to call behavioral issues mental illness issues, because again, we can't have that conversation with them. We can only observe their behavior, but obviously behavior is coming from the place deeper than just how you behave. So
yeah. Well, I think it's dangerous to call it behavioral issues because it puts the blame. This is just for me, when someone just says, oh, he's being a bad dog, or he's, it's his behavioral problem. I think it doesn't allow us to address the real issue. It just says, oh, well, it's behavioral. There's nothing I can do about it. He's just like that.
Yes.
And it's really sad to not be able to address the cause, because so much good can come from addressing the cause, just like you were able to find some herbs that worked for your dog. I guess one of my questions when we're talking about herbs, do you think that there's one herb that fits all?
Oh gosh, no.
Okay. The reason I say that is because I feel like right now we're in this CBD movement where every animal that has any kind of mental illness, we just give them CBD and all is restored in the world. But you don't think that that's...
No. And we don't have a lot of studies in dogs and cats on this, but it has been looked at a little bit in humans. And if you, for example, I live with someone who struggles with generalized anxiety disorder, a human being who does. And when we've looked at studies for CBD dosing to give it a try, it's established, it's out there, but it doesn't work for every patient. And certainly when he has tried it, it doesn't work for him. So this has been my experience with dogs as well, that for some of them, it works super well, like a silver bullet super well.
Yeah.
I would say that's the minority though. And for most of them, it might help to take the edge off a little of their massive anxiety, but it doesn't actually resolve the problem. And a lot of people, once the edge is off, they think things are better, therefore the problem is resolved. But now you just have someone who's anxious and a little bit sedated, and that's how they're living, which isn't awesome either.
Which is the same as the drugs,
exactly.
Right?
It's very similar.
Yeah, that's the problem I see a lot with doing herbs and stuff, is we're doing the same thing. We're still, granted, it's better. It's not going to have the side effects, hopefully, and all of that kind of stuff. But it's kind of dangerous also. We're still not addressing the problem. We're still not addressing the cause. Why? What's going on with the gut? What's going on with it? Have you seen a link between the gut bacteria and anxiety?
Again, in some patients and not in others. And then in some patients where I'm convinced there's a link, but their guts are just so messed up that I am unsure if we'll be able to really heal them to the point of addressing the anxiety within that patient's lifetime.
Yeah.
So we end up using treatments to try to heal the gut as much as we can, but we also do other things. But yes, this is the problem with one size fits all herbs. When you're not going to an herbalist and you're just going to go grab the calming blend of herbs off the shelf at the natural food store, most of those herbs in those blends are sedative herbs. And they have a place. And herbs, they're multifactorial. So they don't just sedate, they're also doing things on other levels that do address the anxiety if you have certain types of anxiety. Otherwise, they're just doing the sedating work, which
Right.
is a good, emergency treatment, really. But unless you're seeing an herbalist and you know that what you're doing is also treating the underlying pattern, the underlying problem, then you are just doing another band-aid. And it's a better band-aid than drugs, but it's still just a band-aid.
I like to, I tell people I think they're great for, I do a lot of boarding, and sometimes we just have dogs that have that anxiety. So I can use the herbs for something like that because I can't address the real
Mm-hmm.
cause right now. And I don't want your dog to go through 2 nights of just, horror because they miss you so much. So
Yeah.
we have all sorts of little things that we can use to help for that. And that's situational anxiety, right? Like
Mm-hmm.
that's like, okay, then he's going to leave boarding and then he's going to go home and he's going to live his life and everything's going to be fine. That's a little different than this constant state of anxiety, which is what you talk about, is using the right herbs, not a sedative herb, to address what might be off that's causing that, right?
Yes, exactly.
So you use a lot of herbs in your patients.
That's really the primary method that I treat my patients.
Yeah,
I practice Chinese medicine first and foremost, and I'm really more of an herbalist than an acupuncturist.
it's
So
amazing.
it's lots of herbs.
I wanted to throw that out there because I have a great question that just came across from Christina Geiger. She has a 12-year-old Jack Russell who's a diabetic. She's just wondering if you have any suggestions on some vitamins or some herbs that could help her. She's experiencing she's taking insulin, and she's on a raw diet and she does all of that, but she feels like something's not right. Maybe the insulin isn't working. Is there maybe an herb or something? She does work with a veterinarian, but she's wondering if there might be an herb or something you would recommend.
These kind of questions are really challenging because certainly in Chinese medicine, and honestly, with what I've learned in other forms of herbal medicine, the answer is always it depends, because there are, 2 dozen or more herbs that would be a good thing for this situation potentially, but it really depends specifically on what the presentation is. Um, so, you could do things with the diabetic supplements that are on the market to help um, with blood glucose regulation and things like that, and those would likely be helpful. Those are mostly vitamin mineral based, though, and I've found that herbs are much more powerful than them. But herbs, especially with someone who's got something like diabetes, they really need to be custom to the patient, and ideally done working with a professional who understands the herbs. Because, for one thing, as you start the herbs, if they're working, you probably are going to have to also change the insulin doses. And so you'll need someone who can help you monitor that and do that appropriately, so we don't now end up overdosing if the herbs are
Right.
doing what they're supposed to do.
Right. Yeah, it's interesting because many years ago, when I first started helping people with diets for diabetic dogs, and this was a long time ago, I had a client who said, okay, yeah, she's going to go ahead and she wanted to do a species appropriate diet instead of doing the prescription diet that the veterinarian was recommending. And so we put the dog on this really great diet. And where I fell short and lesson learned is I should have been having her test the insulin
Mm-hmm.
regularly. And it was a lesson that I learned because the dog got really sick, because he was fine. He was okay. But his insulin, he needed he needed less insulin. He was eating the
Yes.
right diet and things were changing. And so it was a lesson learned that now when I have people that come to me with diabetic dogs, I have to keep them on a regular schedule to get the blood work, because it always results in that insulin lower. And I know Christina, and she had to have her Jack Russell's insulin lowered when she was able to change the diet. So,
Mm-hmm.
do you do consultations where someone could send you their blood work and you could make recommendations to Christina that are more valuable because you have more information?
Yes, I do a fair number of consultations over the phone or over email. Um, and I use the records from their local vet because most of the time these are people who are not anywhere close to me, as
Yeah.
well as, of course, any blood work or other lab results, and a photo of the tongue. In Chinese medicine, we use the shape, size, color, texture of the tongue, as well as the quality of the pulses to make our Chinese diagnosis. So obviously, I live in Oregon. If someone in New York wants a consult, I can't take a pulse on their dog, but they can send me a photo of the tongue, and then I have half of the information I need.
That's so interesting. I
Hmm.
know you had mentioned that before, and I was like, oh, that's one of the things I miss about being in more closely in the veterinarian world is some of the changes and stuff that are happening and things and learning
Hmm.
and kind of cool stuff like that. Although there's not a whole lot of, I don't even think I know an herbalist at all in Orange County that Christina could work with. She's going to have to seek out a little bit, but you would say that there are herbs. Have you seen diabetic dogs be able to get on herbs and completely be free of insulin?
Yes, I have had a couple of patients over the years whose people were very committed, very on board with our programs. They did everything exactly the way I told them to, and these dogs had the capacity for their pancreas to recover. Not every diabetic has that capacity, but they also had that. So with the diet and the herbal regimen that we did, they were able to get completely off of insulin, which is unbelievable. We do that in cats a lot with diet, but in dogs, it's less common.
Yeah, I was just listening to a doctor who was talking about the cats and being able to completely reverse.
Hmm.
But I was hoping, I'm like, oh, it's interesting. They can completely reverse. They've done it with people, so I'm like, why aren't we using this techniques with animals? So it's good to hear that you've seen it happen and you know it can happen. And I just had I bottle feed kittens. I was telling you, and I just had a kitten almost die on me the other night from hypoglycemia. And it's like a week old, and I go in to pick him up and it's just completely just limp. And I thought, oh, I lost him. We do lose those kittens quite often, but I was able
Hmm.
to bring him back. And it was just, I wish I would have videotaped it. I was pretty sure it was at 11 o'clock at night, so I know there's nothing I could do. I think this is what it is. And he just kind of snapped out of it after an hour and a half, and it was just, I wish I would have videoed it so people could see. But it was kind of interesting to watch that whole thing and go through it, and Q-tip in some honey in his mouth like
Yes.
like his little teeny tiny little mouth. And now, you know what, I don't know if you've ever bottle fed kittens, anybody out there, but this kitten is now I think going on right around, I don't know, 3 weeks probably. And he's already eating a raw diet. He eats it, he wants to eat it. Isn't that crazy? He's like, he doesn't want the bottle. And then I have another one who's 9 weeks who refuses to eat anything except the bottle. You're 9 weeks old, you have to eat food. So, but it's been fun to watch. And but I'm glad to hear that about diabetes, that maybe we can get it under control. Is that one that you've seen an increase? Because I know I have. I mean, we hardly ever saw diabetic dogs, and now I don't think a weekend goes by at the spa we don't board a dog with diabetes.
Yeah. All of these conditions that are inflammation related, which in dogs, um, dogs get a weird kind of diabetes that's sort of like a combination of human type 1 and type 2 diabetes. It's very strange. Um, where their pancreas, because of inflammation, the cells in their pancreas that are supposed to produce insulin and manage their blood sugar just kind of start to give up. Some of them die, some of them just are not functional or not very functional. And so we have to do all of the management you think of with type 2 diabetes in humans, with diet and exercise, and in my case, or if you're seeing an herbalist, also herbs and supplements. And then we also have to do the insulin injections, which we don't really do with humans with type 2 diabetes, but type 1 diabetes we do. So it's very fascinating. So the goal with treating a diabetic dog, if your goal is to get them off the insulin and get them to recover, which, like I said, can be very challenging, you've got to do all of the dietary, exercise, herbal therapies, and then you've got to also bring their inflammation level down, because that's what caused this in the first place. And if that continues, it will continue attacking those cells in the pancreas, and they won't have a chance to recover no matter what else you're doing. So it just, there's so many diseases out there that are inflammation based, and maybe we just learned that, or maybe we knew that all along, and those are all the things we're seeing more of.
Do you think that so many dogs, I'm trying to figure out how to set this question up. So many dogs are suffering from pancreatitis since we're kind of on this. I mean, it is an epidemic. I don't know another word to call it. It's so many dogs. Do you think that pancreatitis is a precursor for diabetes?
It certainly can be, because again, the thing that causes diabetes is this pancreatic inflammation that affects the endocrine cells of the pancreas that do the insulin and other hormones, but insulin is the primary one we think of. And then the pancreatitis we see is the exocrine, the digestive functions of the pancreas being inflamed. But of course, they all live in the same organ. They're all right next to each other. So if the pancreas is inflamed, it isn't just the exocrine pancreas or just the endocrine pancreas, it's all of the pancreas.
Yeah.
And over time, enough flare-ups of pancreatitis or long enough run of chronic pancreatitis, low-grade pancreatitis, certainly can affect all those endocrine functions and affect insulin levels and all of that.
It drives me crazy because I want to see the studies, but what I keep seeing is dog gets pancreatitis, dog goes to vet, dog gets better, dog goes on, the low fat, usually a prescription diet, which is filled with carbohydrates and sugars and all that other stuff, but it's low fat. And then 6 months later, the dog's diabetic. And I'm like, we just turned this dog into a diabetic.
Yes.
I'm so glad to hear you say that, because there's so many things that I recognize and see, and I like the flea and tick medication. We can get on that subject forever. It was probably 20 years ago when I said, I think this stuff is causing seizures.
Mm-hmm.
But I don't have the studies, and I can't prove it. So I used to sell the stuff because I came from the vet world, and then I sold Advantage and Frontline for years until I realized it, and then I pulled it off the shelves. But I just think we talk a lot about that on this show, about setting our pets up for failure. And I really think that pancreatitis is the beginning of, if you don't handle it correctly, you will have a diabetic dog. And it's not the owner's fault, right? It's just,
right.
It's never the owner's fault. They're trying to do and be guided by what their veterinarians are telling them. But I always feel like, it's like the skin, right? Don't you think that the skin and the ears are our first, like the hair even, is the first sign that something is going on, and we either start band-aiding it or we treat it right?
Yeah. In a lot of cases, absolutely. Coat quality is, oh gosh. When I took the food medicine course, the Chinese food medicine course, that is the primary thing that we talked about and learned in that course, is that your dog, your animal that you're feeding, whether it's a dog or not, should be gorgeous, really. Barring any genetic kind of issues, they should be shiny, bright-eyed, with a gorgeous, luxurious, shiny coat. Their paw pads should be soft, like fine driving gloves, fine leather driving gloves. If you have hard paw pads, dry paw pads, that is not from running on cement. I promise you, I have had some patients who were definitely running companions for their people every day, all the time. And their paw pads were so soft and so perfect. So it's definitely not what they're walking on. It is what they're eating. Yeah. And the dry paw pads, I think, are in most of them, that's the very first thing that happens. And then we start seeing coat quality changes. And then we start seeing further skin or nail changes. And it just goes on from there.
The nails, I can't tell you how many times, we Dremel the nail and the whole nail will just shred. And I'm like, this dog's got a deficiency somewhere. Something's wrong. And I know, and everything else looks fine, but the nails just, you could just tell. And I think it's very similar to our nails, right? Like, I mean, you can tell you're deficient in something's going on through your nails. We just, I guess, a lot of veterinarians aren't taught that. They wait until, they're not listening to the warning signs that we have out there. Let's go back and talk a little bit about mental illness, because I think that's something that no one else talks about. So I want to guide us back there a little bit. What about dementia? in dogs. I know we talked about it on the show and that it exists. What do you think is causing the dementia in these animals? Are they living too long? Are they?
No, again, I think a lot of it's inflammation related. And we've actually had some research done recently that shows some of these dogs are getting something that is very similar, if it isn't the same, to Alzheimer's, where they're getting plaques in their brains. So there's some of that that happens. Not every dementia is that, just like in humans, not every dementia is Alzheimer's. Um, so there's some that it's just loss of cognitive function as they get older. Of course, all of us as we get older, even if you're doing everything right and things are going super well, there is usually some decline of function in your body from where you were at 20 versus where you are at 80.
Sure.
So it just depends on which parts of your individual body are your weak parts. For some people, that looks like declining kidneys, kidney failure. For others, it's the brain, and we start to see cognitive decline. Just like in humans, there are lots of things you can do. The more you do training, brain games with your dog, the more you use the neurons, the stronger they're going to be, the longer they'll last. But sometimes we can't control it. Obviously, there's an Alzheimer's like condition in dogs. I think that that's inflammation related at its core. But once the process has started, it's very challenging to do much about it. There are some supplements and things that can be very helpful, but it's not like regular cognitive decline where just engaging the brain can be really helpful.
What do you think is causing the inflammation?
Oh,
I know. I'm sorry.
everything. For one thing, there's a kind of chicken and egg relationship with anxiety and inflammation, where inflammation can cause anxiety, but anxiety also causes inflammation. And we just covered how dogs are living far more anxious lives now.
Right.
So that's certainly a part of it. Also, some less than stellar breeding practices. I've known a number of people who will breed animals that fit what they want for look, but they're not paying attention to other health things,
Oh yeah.
like someone's older and they've got some liver decline, but they're like, that's okay because that happened in this dog's old age, so it's probably not heritable, and they are really pretty, so we're going to keep breeding them. But of course, that kind of stuff, that dog was predisposed to liver conditions. Now you're breeding him and he's passing on that predisposition after you already know he has it.
Yeah.
So that's a problem. And then over vaccination, both in an individual and in their line, because of epigenetic changes that happen that can then be passed on. So even if otherwise your pet's breeding is really good quality, healthy dogs, if they were fed poor food, if they themselves the ancestors were traumatized, or if they were over vaccinated and had higher levels of inflammation themselves, those things cause changes in their genome, which they can then pass on. And now your dog is starting kind of behind, because that's the nature of how these things work. And then most of the time, they end up over vaccinated and on poorer quality foods, and then living a moderate to high anxiety life. And of course, that just adds up to a lot of inflammation. And like you said, most of this is not the pet parent's fault. Obviously, a lot of times we don't have control over their ancestry and what happened there.
Right.
But also, I've had so many clients that come to me halfway through their dog's lives, and they've been perfect clients. They've done everything that their veterinarians have told them to do. And when I look at the records, I can see that that's exactly where the problems have come from.
Yeah.
And that's, it's not their fault that they found a professional and trusted that person.
Yeah.
And that person just didn't have a complete understanding of this. A lot of times it's not even that veterinarian's fault. They don't know what they don't know.
Right. And that's one of the things we do talk about on the show is that, it's not your veterinarian's fault. No client goes to the dog food store and says, I want the worst food at all that you can feed me because I don't really like this dog. And no veterinarian goes, I'm going to set this pet up for failure. Mm-hmm. No vet goes all the way through vet school and loves animals and did everything to become it and paid and doesn't make very much money and deals with all the stresses of it to prescribe something to your pet they think is going to set your pet up for failure. It happens because there's a breakdown in the system, if you ask me. Mm-hmm. Like our vet schools are not teaching our veterinarians in my opinion, proper ways to do it. So that's why I do this show, because I want people to be educated themselves so that they can make these better choices. So when we talk about diet, I don't know if you can do this, so I don't want to put you on the spot, but are there like your top 5 foods that would cause inflammation to stay away from, or top 3 or top 1, or, we have a lot of people now that are starting to make their own foods, which is good. Sort of.
So there are a couple, and this really, it is my allergy talk when we're first talking about let's change the diet with allergies, and with someone who's not tried anything at all in the past. So we're just starting with the basics, and the basics are avoid chicken. Chicken is the number 1 meat allergen for dogs. And I do believe that it's not just because so many dogs are exposed to so much chicken and sensitive, allergic, not just sensitive, but allergic to chicken. It's also because the way that commercial chickens are raised is just so pro-inflammatory. And of course, unless you're buying organic dog food that has pasture raised chickens in it, it's those cheap chickens that are ending up in dog food. So those chickens already have a ton of inflammation, and now you're going to eat the chicken and all that inflammation goes in you. The other top 2 ingredients that I tell people to avoid when we're starting to address diet for allergies or other inflammatory conditions is get away from grains, because it is not every grain. There are some grains that are generally okay, like I don't see a ton of problems with barley, some in some individuals, but not loads. I don't see very many problems with quinoa, which is not technically a grain, but we consider it a grain. But certainly corn and wheat are hugely problematic, and rice is just following right behind them. Because again, what gets into dog food is typically the very cheapest of these grains, and usually not food quality, but feed quality. So the kind that would end up in livestock feed, because that's the class that your dog falls into as far as the FDA is concerned. And so, of course, these are highly hybridized. They are typically not organic, so they're grown with tons of chemicals. A lot of times they're GMO so that they can put even more chemicals on them. And those chemicals and the hybridized grains both cause a lot of inflammation. So just to make it very easy, I just tell people avoid grains altogether, and then avoid chicken. Those are the top 2.
Yeah. Yeah. It's interesting because I had a woman come to me and she said that she thinks her dog's allergic to chicken, but she had an allergy test and it didn't come back that the dog was allergic to chicken. And I don't know if I'm 100% right on this, but I have done this with other clients. I said, it's possible that maybe every time you give him this chicken, it's actually the hormones and the other stuff in that chicken. And so if you really wanted to find out, I told her maybe and I carry, of course, hormone-free pasture, all that kind of stuff. I said, you could try that and then see if you get the same reaction so you can know. But I agree with you. You have to eliminate as best we can. There's so many things that can be causing this, but those are kind of what I always say too. You got to stay away from these grains. And you're right. And then I'll always have somebody that fights back and says, but you can get the best quality, this kind of grain, but that's not what's in dog food.
Exactly. If you want to make your own food and grow your own heritage wheat berries in your backyard and feed that to your dog, awesome. That's a level of work I'm not prepared to do. But if you are, and I have some clients that do that kind of stuff, perfect, great. As long as your dog is not actually allergic to that ingredient, you're going to be fine. And this is part of the problem with the allergy tests for food. Allergy tests are focused on true allergies, which means there is an immunoglobulin reaction happening. That's what we're trying to measure in the blood. But with food, so much of the reactions we see, and this is both reactions on a digestive level, eating something and having digestive upset from it, or reactions elsewhere, like skin problems, of course, are the one that we think of most in dogs. But I've also seen behavioral issues or an exacerbation of mental illness issues from diets that dogs are sensitive to. That sensitivity is not causing an immunoglobulin reaction. So if you run the top of the line blood allergy panel, it will likely tell you that food is fine, but there's something about that food and the gut and how they interact that there is an inflammatory reaction there. And it's not an allergic reaction. So this is what we call food sensitivity, and they're much harder to test for. You basically, to get a solid answer on it, you basically have to do an elimination diet. And then, of course, your comment about the chicken that you carry on trying that, there are lots of factors to a food sensitivity. If you're sensitive to wheat, you may not be sensitive to all wheat. It may just be the super hybridized GMO covered in chemicals wheat, because actually in humans, they're finding a lot of wheat sensitivity is actually glyphosate sensitivity, which is Roundup. So it's a sensitivity to that chemical that's all over most of the wheat that we eat. And it's just proof that lots of those chemicals end up in our food. And of course, our pets' food as well, if we're feeding those highly sprayed crops.
It's so frustrating because you want so much to do the right thing for your animals. They don't live very long. And so we're, grasping and trying. And then you read all of this stuff and you think, and chicken, of course, I've seen so many animals get off chicken and do fine. But it's just frustrating. And then you find out it's glyphosate and it's all this other stuff and you can't keep up. And so it sometimes people give up and it's hard. Christina asked another question. You kind of got into it a little bit, but I'm hoping you'll talk a little bit about human grade, because she asks, is it okay to feed chicken and occasionally grains that are human grade?
Well, the answer is my favorite answer, of course, it depends. And you'll see a lot of food companies now making the claim that their products are human grade food. And of course, with food labeling, some claims are like saying something is natural. They're kind of gimmicky. There's nothing that defines that legally. But saying something's organic is a legal definition. Saying that a product is a human food quality product, that's a legal definition too. So if you buy a dog food that says human grade food, that means something. And so it depends, because it depends on the quality of food that you are sourcing for your homemade diet. If you're sourcing human grade wheat from the store, let's say it's wheat, but you're not getting organic, then what you're getting is better than feed quality grain, but it's still not awesome. And for an animal who is on the spectrum between carnivore and omnivore, but not as much of an omnivore as we are, that's still going to potentially be a problem, because we have this layer of, it's a little harder for them to process grains and other vegetable matter than it is for us even, and it's not super easy for us. And then if you're not buying organic heritage, it's hybridized and organic, or it's not even organic and it's covered with glyphosate, now we're adding all of those things into the equation. So if you're buying organic heritage grains and you're cooking them really well so that they're easily processed, then unless your dog is allergic to that grain, it might work okay. But I really feel like another cause of inflammation is too much sugar, and starchy grains are just sugar, really. So most of the time I feel like they're not a great option, grains specifically, or other really starchy carbohydrates. Not really necessary for most of them.
It's just easier to say, just stay away from it, because it's
exactly
too
very complicated.
It's so hard. Just stay away from it. It's not. And if it's in your subscription pet foods that you're getting delivered to your home, I guarantee you it's not going to be the high quality grain that we are talking about. So it's just easier for everybody to stay away from it. Can you, I don't know if we made it really clear, or if you did, you mentioned, we talked about feed grade a little bit. Can you explain why, like when we flip over a bag, if you're feeding your pets kibble, you might flip over a bag and it just says chicken, but most of those, can you explain the difference between a feed grade and a human grade and what that difference is? And I don't know if you know that much about labeling. Do you, about why?
Moderate amount.
Okay. So we could skip over it if you want, but as she brought this up about human grade, it got me all into this feed grade, human grade stuff. And it's important that people know, because I want the laws to change. It should tell you, right, that it's feed grade. And
yes.
But your understanding of feed grade is what?
That it's not held to the same standards as human food, for one thing. I actually just recently scrolled past a post of someone being shocked that insect parts were allowed in human food, but that's, if you've not looked at the FDA's standards for food production and quality control, it's an eye-opener how much stuff is allowed in human food grade quality products. When you're talking about big industrial factories, it's impossible to keep all of the rat feces out. It's impossible to keep all the bugs out.
Yeah.
And so there's a certain amount of these contaminants that are allowed per kilogram of food. So the standards for feed grade foods, like if I were to, well, when I go to the store and buy a bag of barley for my horse, there are far different standards for that barley than when I go to the grocery store and buy a bag of barley for myself, as far as cleanliness, as far as things that are not barley ending up in the bag, whether that is contaminants or whether that's just other, like a piece of corn or something like that. The standards are just totally different. And when we're talking about meat, mostly I've talked about grains because mostly we're talking about like livestock feed to make it understandable, but there's a difference in meat as well. And there are, diseased meats are theoretically not allowed into the human food supply. And hopefully that's being kept the standard at most slaughterhouses. Yeah. But with animal foods, that's not necessarily the case when we're talking about feed grade meat. So and this is again a contributor to inflammation. If we're not just talking about a chicken that grows super fast, that was eating hormones and antibiotics, living on top of other chickens, but it was also sick while that was happening, now we have a whole nother layer of inflammation that's being introduced that would not even be the case if you went and bought a conventional chicken breast at the grocery store for yourself. This is a different level of poor quality, and it's a big problem.
Yeah, it's particularly a problem where I get very angry about it is that you don't know if you're buying, and that's why I refuse to sell kibble, because kibble, they're allowed to write on there just chicken, and that chicken could be feed grade, and in most of the time, I'm sorry, it is. And of so you would cheaper. Never, it's way cheaper. So you get this food and it's all feed grade that you don't even know. And it bothers me that pet parents don't have the option. If you want to feed your pet feed grade and that's something that you can afford and you want to do, but you should know. They would never do that to humans and be like, oh, this is the rendered stuff of the dying, diseased animals, but don't tell anybody. Same as carbohydrates, right? If you look at the bag of dog food, they don't list carbohydrates, but a human food, it will tell you how much carbohydrate is on it. And that's the trickery. And that's a whole nother podcast, right? Like we could get into that, a whole nother podcast. Kim Ann asks a question, and I'm very excited about this question because after you answer it, I'm going to tell you something very exciting, Kim. But Kim wants to know, what are your thoughts on an organic, vegan, home-cooked diet for a senior dog? And then in parentheses, she puts Fox and Hound Beagle mix. Thank you both so much for another great discussion. You're amazing. Thanks, Ann. Kim?
This is a very interesting question. So because of who dogs are, I don't like them on vegan food as a first choice. I've met a few patients that were allergic to life, and after a process of elimination, we couldn't find any meats that they could eat, and they were intolerant of dairy, so we were kind of backed into a corner. But generally speaking, I don't like it if it's at all possible to not do it. And if you're using a processed vegan food, the vegan diets that I've seen dogs do okay with are typically homemade, with a balancing supplement of some kind to make up for the deficiencies that are going to happen in a vegan diet for a carnivore. But when you're buying the processed stuff, again, back to this quality argument, a vegan diet for a dog is already hard for them to process, hard for them to get everything they need from, and we're already going to have to supplement it. That's just how it is. If we're adding on top of that the quality of the vegan ingredients are poor, then that's just a whole different level of poor diet for this dog. So really, I don't know much about the food brand mentioned there, so I can't comment on that specifically. That's the breed.
That was the breed. I thought it was the food too at first, and then I reread it and I was like, oh wait, that's her dog is a mix between a foxhound and a beagle mix.
Okay.
Because I was like, beagle mix, that's probably a dog. Yeah.
So I have a patient who's on a vegan diet and is a senior dog and has a lot of other issues happening, and a number of them are digestive focused. So as much as I do not like this dog being on a vegan diet, we can't really change that right now because she's so sensitive and unstable generally. But what I would love to change that has not changed yet is that I would love this dog to not be on a processed, I think she's eating a canned diet of some kind. But on a processed vegan diet where the ingredient quality is questionable at best, I would really like her to be on a home cooked diet where we have total control over the ingredient quality.
Yeah. Kim actually says that. She says it's a home cooked diet that she's talking about. So obviously that's what Dr. Ericka is saying, is that if you're going to do vegan, and I agree with you, I have gone through, and don't send me an email hating me, every single vegan diet that is on the market that I have been able to see, and that is a lot of them, have all been mostly on rice, potato diet. So and the thing I wanted to tell you, Kim, that I'm very excited about, and to the rest of our listeners, and maybe even to you, Dr. Halle, is that I am getting ready to do a podcast with it's going to be aired in a while, but we're doing a podcast with Dr. Richard Picarin, and we're going to be talking about plant-based diets. So he's been doing a lot of studies on it and a lot of stuff going on. And so we're going to talk a little bit about it. He didn't think I would want to. And I think a lot of my listeners will be surprised that I will, because I have been feeding my pets, raw meat-based diets for many, many years. And I'm a big supporter of it. But I'm also a big supporter of people that I think Dr. Picarin is very, very intelligent man. And I think he loves animals, and if he's found something that is working and is providing them the taurine and all of the amino acids that they need, then I think we should listen to him. So we're going to be doing a whole podcast on that and see what we can come up with. It's hard when you think about the sustainability, right? You can get into that whole, like, are we even able, as we keep as a society, and people like you and I are out here going, feed your dogs healthier raw meat, and that's leading us away from the kibble, which is heavy on junk food, in my opinion. But are we able to sustain all of this meat to feed all of these animals? So I think we should look.
This is a huge pet peeve of mine in the current fads in the raw feeding community. When I started doing raw feeding, I was working with someone who'd done it for 10 years, and they were doing a diet that was a mixture of meat and vegetable ingredients. In most cases, we were doing 75% of the meat organ bone mix and 25% of the veggies, depending on the individual. Nowadays, I'm seeing this movement away from feeding dogs any vegetables at all, where they're just doing the 80-10-10 mix of meat, organs, and bone, and that's it. Yep. And maybe some veggies as treats or something. And first of all, I think that's not a great plan, because our land is not the same as it used to be. So the grass is not the same as it used to be. So the meat is not the same as it used to be. So we have to get our trace nutrients from somewhere, and it's not really going to be the meat. And because of the sustainability question, dogs, they are not obligate carnivores like cats. They can and do process some vegetable matter if you prepare it right. You can't just toss them a head of lettuce and expect them to process that, but they can and do process vegetables. And so they should, both because we need a place to get these nutrients from, and because of the sustainability question. Yeah. It's a huge thing, honestly. And to revisit the vegan question briefly, as someone who spent over a decade as a vegetarian, and then with all of my deficient health problems, I realized after reading a book called Healing with Whole Foods, which is very focused on plant-based diets, but does include a discussion of eating meat, I realized that I just couldn't be a vegetarian anymore. My body could not handle it. So with vegan dogs, I feel like the ones I have seen that do well are on not a processed diet. They're on a homemade diet, and they tend to be dogs who are already very healthy and possibly younger. And as they get older and start getting more deficient, I see more and more problems with it, because the more deficient we are as omnivores and facultative carnivores like dogs are, the less we're able to process the plant matter super well. And meat and other animal products like dairy are very easily accessible forms of sustenance for our bodies. And so sometimes even just a little bit of that is really necessary as we get older and get more deficiencies and all of this kind of thing happening.
Yeah. Well, we've taken up a lot of your time, and I the questions that are coming across are great. You answer them so great and so with such great respect for the fact that you don't have the animal in front of you. And I appreciate that about you, that you're not just like, oh, do this and do that and everything will be fine and magic and it works great. But how can a lot of our listeners come from the area where I am, but they are all over the country, and you do these consultations? How can they get a hold of you?
So you can visit my website, healinghandspetvet.com. And that's got my phone number and email on there, but I'll give those as well, because that's the easiest way to get a hold of me is email me. And that'll get you the fastest response as well, usually. And the email is contact@healinghandspetvet.com. Or you can always call us, 541-740-9106, and we can set up a consultation.
Okay, awesome. All right, well, I'm going to go ahead and let you go, but is there any last minute things you want to say? I know we kind of got all over the map, but is there any last minute thing? That's what I like about doing these lives, is I want them to kind of go all over the map, because when we do the podcast, I don't want people to think that you can just cover one subject. You're so amazing and know so much about healing animals. I want them to know that if they do have a dog who has diabetes or is having any of these problems, they can get so. But is there any last minute things you want to say?
To quickly revisit the CBD thing, the one thing I do find about CBD that does make it a decent thing for everybody at some dose, we don't want a sedating dose necessarily, is that it is an anti-inflammatory and very safe. And, we've talked about every single question I answer, I feel comes back to inflammation, because just about every single problem I see in my patients seems to come back to inflammation.
Yeah.
So in addition to doing things like following a minimal vaccine protocol, feeding a species appropriate diet, if you're getting an animal that you're getting from a breeder, trying to make sure that they've got the best lines possible, in addition to those things, doing some general anti-inflammatory treatments with some regularity, maybe not every day for a young healthy pet, but maybe intermittently, a little bit of turmeric or a little bit of CBD to help, because there are things, we've been talking a little bit about glyphosate here, and that's something that, even though I eat pretty much exclusively organic, I know it's in my food because it's everywhere. It's in our water supply, it's in the soil. So even in an organic farm, there's going to be some. So you can minimize these things, but you can't totally avoid them. So we're going to have some inflammation from just the world we live in now, and doing these kind of basic anti-inflammatory measures, at least intermittently, can really help in the long run.
You're so amazing. Thank you so much for coming on. And we'll reach out after the show a little bit, because I want to talk to you about some of the other projects that you are involved in and doing. And then maybe we could do a little side podcast that's not about dogs, but it's about people in general, right? And because I think it's important, even if we can bring it right back to our dogs, but our dogs can't be healthy if we're not healthy.
Exactly.
And so we might have to do a little podcast on it. So, but I'm going to go ahead and let you go. And thank you so, so much for, just being willing to just give your time and, just helping animals and people with their animals. I just so appreciate it. Thank you.
You're very welcome.
Thanks. Lori, thank you always from behind the scenes. We wouldn't be here tonight for sure if it wasn't for Lori, because I couldn't figure out my computer to save my life. I don't even know what was going on. To all of our listeners that continue to support us and listening and coming on and asking questions, I can't tell you how important it is that you are here and that you're asking questions, because there may not even be people on here live, but they get to find these later on. And, they might not think they need it. And then all of a sudden their dog has diabetes or has anxiety, and they can find these. So your questions and you guys joining us is also so important. So thank you for always being here with us. And everybody have a wonderful evening. All right. Bye, everybody.